welcome to our edition here of Bean Bag Banter. And you guys are here for a treat. We have awesome Dr. Samuel Nokuri here of Premier Health Express Urgent Care in Columbia, Howard County, Maryland. Welcome, Dr. Nokuri.
Thank you, ma'am, for having me.
All right, no, thank you. So our program today, if you're watching, if you're listening to the podcast, thank you for listening. But if you're watching right now, you're seeing our awesome attire of Dr. Nokuri here, who is serving in the armed forces as well. Care to talk more about that?
Absolutely. I'm actually a veteran, and I'm also still serving in the Air National Guard as a flight surgeon. And while I'm not serving, another greater passion that I have, obviously, is this center here at Premier Health Express, which is a very unique urgent care with our partners, with Warrior Centric Health. It makes us the first urgent care in the entire nation certified to provide care to our veterans and their families.
Did you say entire nation?
That will be the entire nation.
Wow.
What we have done is really unique and something that has never been done before. Going back to all the challenges and difficulties in access, if you think about it, of our veterans not being able to be seen in the VA when they're supposed to, this certainly was something that was on our minds. And we wanted to create a model that would be sort of a one-stop single point of care for our veterans and their families. So that makes us essentially, not only that, but if you also think about it, one of our partners, Warrior Centric Health and the Warrior Centric Healthcare Foundation, they are the credentialing body. And what they've done is for all of our employees who are working at Premier Health Express, they have to go through a training to understand the plights, to understand a lot of the challenges that veterans and their families face. So our staff are trained appropriately to be able to provide the care needed for our veterans and their families.
Thank you. Thank you for doing that. And again, to the viewers of this Beanbag Banter, to the listeners to this podcast, if you're in the armed forces again, super thank you. And to those people, visionaries such as Dr. Nokuri, of providing this type of service to the people that has given us the freedom and liberties to be able to do such things such as this. We thank you. And given that, you mentioned about something about the VA earlier, and from what we know is that veterans are not necessarily getting the appropriate service, especially after serving. Care to talk more about that, please?
Yeah. No, Manuel, there's no doubt that the conversation needs to take a different shape. And by that, what I mean is, rather than being a little bit political over the things that are happening to our veterans, their families, it's about time for us as a community to really look at the stats that are out there. So there is the underlying notion, and maybe in the best intentions that I can think of, that veterans have access and that they can be taken care of at the VA. That could not be further from the truth. The fact that 7 out of 10 veterans continue to get their care outside of the VA. So it's about time that as a community, we're looking at creating different type of models that are safe, that have the necessary amount of services. So that will be both pediatrics, adult, behavioral health services, and so Premier Health Express was able to look at all the data that is out there showing, especially in Howard County, which, by the way, I'm very super proud for Howard County to also be the first county in the entire nation to start, this type of a model for our veterans and their families. But again, it's a one-stop shop that veterans and their families can come and get all of their care without necessarily having to face the backlog that we have now in the VA.
And I want to go back to that number. And I want to make sure the listeners and the viewers understand. You said 7 out of 10 get outside of the VA where they're supposed to be getting
That's right.
because they are a little bit packed or they're a little bit
That's
overwhelmed.
Access is the main issue. And, again, even in this 70% that we're talking about,
Okay.
a lot of, this amount of data that we're seeing and the trend that is showing is that it's around the suburb areas as well. Caucasian males, for instance, are in a higher sort of strata class than any other race. But if you think about some of the cares that they're getting, which is very interesting actually, Manuel,
Okay.
you would think that they are all service-related type of issues, but they're not. They're actually routine type of things that ordinary individuals like, hypertension, diabetes, cardiovascular diseases. So again, going back to the underlying, notion of that it is critical that our men and women that fight for us, for our country, are able to be seen for these very common things that still plague the general population, and not be at risk and be put in an at-risk pool, which literally that's where they are at this time.
Okay. So again, to all the ones viewing this or listening to this, politics aside, please find ways to go ahead and reach out to our political leaders. I don't care left, right, I don't care. We don't care. The important thing is that their priority should be the veterans who has been serving us, who's been taking care of us. And we need to give the care back. And again, if that's the 7 out of 10 there, we need to continue to find ways. And again, with the vision that Dr. Nokuri has here, hopefully the other medical doctors out there will go ahead and follow suit and help our awesome veterans out there.
That's right.
Okay.
That's right.
So there are certain. So obviously you are here in Howard County, and again we're super proud to be here as well, and we're really trying to find ways to always give back to the great community that we have here. But how about for others that's not around here? How would they be able to reach you?
Yeah. Well, again, the great thing about the model we have set is really also it addresses the health disparities that are currently existing in our community.
Okay.
Right? So if you think of, again, how the uninsured population, the underserved individuals that have access to dental, they have access to have maybe a good prenatal program, all of those things. Behavioral health, we know, is on the rise, depression and suicide rates and bullying and all those type of things. So, again, a great way to be able to have the model that we have is that it provides a generalized access, not only to our military family, but also to our underserved area. There's one other key part that I did mention, which is our telehealth program. So, we take walk-ins, we take, so folks can meet us through online, Facebook and Instagram and those things, and reach out to us, and we can certainly be able to connect that way. But in many issues, actually, in those key populations that I mentioned, transportation is a major issue. And so in those situations, our telehealth program becomes a major conduit, becomes a major platform that it can reach us in the comfort of their own homes. It could be at work, it could be in even on vacations or something like that. Again, access is important. I'm a strong believer, Emmanuel, that if people have access, then they start to understand and they're empowered to take control of their own care. A lot of the anxiety and the angst that I get from my patients is, they start going to the internet and they start Googling and finding out what is wrong with me.
And trying to do self-diagnosis.
Exactly. So again, if they have that access to know that they can just call their doctor and go to the heart of the problem of what's going on, that gives them a great comfort and assurance.
Yes. So, by all means, do your necessary research.
Yeah.
Great. But that's why we have medical doctors who have studied and do continue education units to be up to date with their research, reach out to them. And definitely, access to care is indeed one of the issues that we're all facing. And again, if we bring politics again, these are things that they keep talking about. But here we are, we have Dr. Nokuri providing this access to you right now. How do they reach out to you using telehealth?
So, a couple of ways. The
Okay.
first could be they can get online
Okay.
on our website, and they can go down to where they have virtual visits, and they can connect that way to us.
Okay.
The other way would be to just call directly
All right.
into the clinic, and we're able to walk them through. The great thing about the virtual care we provide is that it uses any type of platforms. So you can use Google Hangout, they can use Facebook, they can use WhatsApp, and so it's or Skype, for instance.
Or Skype.
Skype is the big one. So again, the most important thing is what we're trying to do is to match what level of comfort others have. And again, if you're not, tech savvy, or some people don't want to necessarily be seen, or then you can just call directly. The element of telehealth doesn't have to be a virtual, visit or face to face.
Okay.
But just a simple phone call can do it too as well.
Simple phone call.
That's
All
right. That's
And
right.
speaking of phone call, I'm sure you guys are ready to go ahead and get this number down.
It is 443-899-9525.
Awesome. Thank you. And then the website, in order to go there, if that's what you want to do,
That's right.
is
www.premierhealthexpress.com.
all right. Awesome. And then obviously all of this data, we're going to put it on our verbiage wherever you're viewing it or where you're listening to this, and so on and so forth. So I have an idea of what telehealth is. Some of our viewers may not have an idea. So you're saying as long as you have internet access or a phone, we can go ahead and do those things.
That's right.
So that's anybody in the world
That's right.
who has internet access
That's right.
would be able to reach you,
That's right.
especially to our service members
That's right.
who are serving across the globe.
That's right. That's right.
And the thing here is you don't have to wait for a setup.
Right.
You can go ahead and reach out for common issues that you may have, common problems that you may have, and no, you don't have to wait for an appointment wherein they can go ahead and see you right now.
That's right. That's right.
All right.
That's right. No, it's a great wave of the future. It's something that has been around for a while, but now has become really at the forefront because of the several gaps in care.
Okay.
Whether it is in the hospital, from hospital to discharge, or whether in our case, when our patients come into the urgent care, one of the ways that we use telehealth is to schedule them for a follow-up. And patients do like that. But again, a major part of why we use it, as you had mentioned, is in the behavioral health services platforms.
Okay.
And so for many of our service members or patients who might not feel comfortable coming in initially, or at least be able to have that avenue of access again, to start to deal with some few things before things do escalate and get out of hand.
Before it comes out of hand.
That's right.
And again, we have the saying, and with one of our Bean Bag Banters that we did is that, and we have heard that saying, an ounce of prevention
That's right.
is better than a pound of cure. And that saying is there for a reason.
Yeah.
So one of the possible common questions that people may have about telehealth is how do we pay for that?
Yeah. Well, if you look at the health care costs,
Okay.
it's completely getting out of hand.
Yes.
The deductibles are constantly going higher and higher. And just the wait times are just becoming ridiculous in the ER. And so one of the few things that telehealth does is that, first of all, it is extremely cost effective.
Okay.
At Premier Health Express, if you are a Premier member, you get telehealth free. So you get unlimited access free. But other than that, if you just sort of want it as a service, especially for instance, students, as other folks, sometimes they don't have, they should have insurance, but again, not to be seen on a regular basis. then for a very low cost of about $19 a month, you can have unlimited access, to our telehealth. So that was allows at least for folks to know that if you have a phone, smartphone for the most part, if
Yes.
you think about it,
Yes.
you have a doctor.
Okay.
Truly indeed.
Let me clarify that. $19 a month, unlimited access?
Unlimited access. And by that, what I'm also, I guess I got to get into it to describe.
Sure.
So the virtual platform is actually like an actual visit in the clinic. So
Okay.
when you call, you actually are put, sort of on hold so that you make sure that you set up and the platforms are compatible. And then the next thing that occurs is that the visit actually takes place at that virtual platform. Sometimes if it's a rash, I would want you to take your phone and put over the rash so I can see and know how it looks, to be able to be
Okay.
able to actually diagnose it. But once the diagnosis is made, we're also able in that platform to prescribe. So
Okay.
depending on the pharmacy of choosing, we're able to prescribe medications and send it to that pharmacy. So again, cutting the long wait times in the ER, cutting the trips that you have to drive all the way, whether it's to go see your doctor or it's so far away. If you're on a vacation and you're in a bind, telehealth is your solution.
And yes, it's indeed a solution. It's cost effective. Just think about this. Just like what you mentioned, the commute to go from point A to point B, to go ahead and sign in and so on and so forth, and you have to go ahead and wait. If you can go ahead and ask a doctor sooner than later, and have that peace of mind of being able to talk to a medical professional, that is super important. That is more priceless than whatever your deductible is and so on and so forth.
That's right.
So give it a chance. Go ahead and find out on how this could go ahead and help your lives easier. And if you make your life easier that way, instead of going to an ER, the emergency room would not be super packed with all of these people, wherein a simple problem could have easily been addressed by Dr. Nokuri through telehealth. All right, awesome. I don't think I've already talked about our awesome background here, the great eagle here. So again, to those who have served in the military and in the armed forces, we are very thankful to what you guys do. To your loved ones, to your family members, to your friends, thank you again for being part of that awesome service. All right, so we've talked about that, and again, and here you are. You're in urgent care here.
Yes.
All right. Why should we go to an urgent care and not ER? Is that something?
Well, like again, we've mentioned, cost is a big thing,
Yes.
right? I would say an urgent care in some cases might be anywhere between 1/3 or if not half the cost. Then the other thing is the wait times, as you can imagine. Longer wait times, and sometimes it's for something that is relatively trivial, simple, straightforward, that can be diagnosed. And then obviously the final thing is that experience. All right, and you mentioned the eagle, which by the way I have to acknowledge that the eagle and a lot of the decorations, if you should come to Premier Health Express, was done by the most fabulous lady in my life, Dr. Nokuri. She's got great aesthetic beauty and sense for arts and things like that. So this was her idea. While she might not be serving, but she wanted to make sure that all the decorations in here honor men and women who are serving at this time. So going back again to the ER, that level. Most people would tell you when they go to the ER, it's extremely. They feel rushed. They feel, and don't get me wrong, it
has its
serves its purpose for what it does, but Premier Health Express, really, you still get that sense of having all of the things that an ER would do, but in a very truly comfortable setting. So we have an on-site X-ray, total body X-ray. We've got an on-site lab, right? And then we also have an on-site pharmacy. So you really don't have to essentially go anywhere after you leave Premier Health Express. Now, if you're really, really sick, then obviously we're able to admit you from here. But other than that, you've got a one-stop shop where everything can be done.
By any chance, you have statistics like, to those who go to ER, how many of those are really definitely ER necessity versus, you know what, you could have just gone to your urgent care or you can just do telehealth.
I might not.
Yeah, I mean,
I understand the worries,
but
but I might not necessarily have the number. But what I can tell you is that a huge part
a huge part of that,
of
yes.
the healthcare costs that we've seen
Mm-hmm.
has to do with readmissions, not readmissions back into the hospital, but also going to the ER.
Mm-hmm.
It has to do with the third. It has to do with the uninsured not having a place to go. Start to go to the ER when they're completely broken. And fourthly, some people, again the uninsured mainly, still use the ER as if it's a primary care setting. Much of it has to do with the fact that maybe they don't know, and they don't know where to go. And so again, it's really a process that we have to educate patients. We have to highlight the great advantages of going into the urgent care versus going to the ER. But again, making sure that urgent cares are equipped enough to have the necessary services that would deter some of these very soft, emergencies that end up going to the ER that can be taken care of in an urgent care.
That's awesome. And that would be a great teaser because in the next few series of our videos, we're going to provide an awesome tour here to his awesome clinic here and to see all the services that he just mentioned. And all right, so good stuff. So again, if it's an emergency, really try to identify. Obviously, ER has its place. But if you're not too sure if this is really ER worth it or to do something else, go ahead and reach out to Premier Health Express first and see if that's something that that's indeed an emergency, or you know what, we can go ahead and take care of it right here, either through telehealth or visit their awesome clinic here in Columbia, Howard County. And we were talking about the ER being swamped or being overburdened. Listen to the podcast that we did with Mr. Snellgrove of Howard County General Hospital, and this podcast is is housed under Howard Community College. So please listen to that, so that as we discuss on how we can all help each other out, you, the citizens, the community members, and try to identify where to go in order to simplify things so that we don't unnecessarily overburden. And especially, and again, just going back to the veterans, and that was the main purpose of this video. Here he is, Dr. Nokuri, and to all the other medical doctors, medical practitioners, find ways on how we can go ahead and help out our veterans, our armed forces people, and their family and loved ones. All right, so that's it for now. But definitely we're going to have some more videos, some more of these Bean Bag Banters to talk about all the other services that Dr. Nokuri offers here. Thank you everyone for tuning in, and more importantly, Dr. Nokuri, we salute you.
Thank you.
Thank you so much. All right, thank you. All right, everyone, thanks.